Welcome to the Community Hospice Self-Learning module on HIPAA, the Health Insurance Portability and Accountability Act. After completing this module, you should have an understanding of what HIPAA was designed to accomplish, how it impacts your work here at Community Hospice, and how to report violations. HIPAA was created to protect the privacy and security of patients' personal and health information, standardize billing, and specify the rights of patients regarding the use of their medical information. All employees, volunteers, and students of community hospice are required to complete HIPAA training. HIPAA requires the protection of the privacy and security of an individual's protected health information. Organizations must also inform individuals of ways in which their protected health information can be used. HIPAA also requires that organizations develop and maintain policies and procedures related to HIPAA laws. The principle of minimum necessary means that healthcare organizations will only use and disclose the least amount of protected health information necessary and will only request the minimal amount necessary to ensure quality health care. Here's a listing of the protected health information under HIPAA law. Please note that in addition to demographic and billing and claims information, lab results, x-rays, and prescriptions are included.
I'm an admission nurse. I have admitted J.M. Hospice today for lung cancer. I have sent a medical record request to Baptist Medical Center requesting the complete medical record for this patient. Did I do the right thing?
It's important to ask yourself these questions. Is a complete medical record really needed in order to provide care for this patient? And should I request more medical information than is needed to do my job? And the answer is no. The admission nurse should only request medical records related to the patient's lung cancer and related conditions such as COPD. Remember, the rule is never request more information than is needed. Sometimes one of our admission or team doctors may request additional information that seems unrelated to the patient's hospice diagnosis. This is because there are some secondary diagnoses and comorbidities that directly affect the care community hospice is providing to the patient. If you have questions about whether information requested goes beyond minimum necessary, ask the doctor or your supervisor for clarification. HIPAA mandates that patients and/or their legal representatives be advised of community hospice's privacy practices in writing. They must also be given the opportunity to ask questions or put specific limitations on the use and disclosure of protected health information. At the time of admission, patients and/or legal decision makers receive a copy of Community Hospice's privacy practices, and they acknowledge receipt of this as part of the signing of their admission consents. The provision of a phone number for the patient or their legal representative to report violations of their rights under HIPAA and state laws is a requirement under Florida law. The three areas that HIPAA allows for the use and disclosure of protected health information are for treatment, payment, and operations. An example of operations would include, but not be limited to, things like quality assessment performance improvement activities, staff teaching, and disclosures that are required by law. The best way to approach protected information is to think in terms of all personal and health information that exists as protected, no matter what form, whether it's written, spoken, or electronic. This is a list of the most common staff who may have access to protected health information. However, everyone in our organization should be aware of HIPAA's requirements. Protecting privacy and security is crucial because it's the law, it's the right and ethical thing to do, and community hospice policies and procedures require it.
I'm a social worker for the Southside Home Team. My mother calls me to say her best friend Amy has been admitted to the West Side team. She asked me to find out what her friend was admitted for and what her condition is. Should I give this information to my mother? After all, she is my mother.
These are the questions to ask yourself under this circumstance. Does the social worker need to know what Amy's diagnosis condition is to do her job? Would you want others to have your private information under these circumstances? And the answer is no. The social worker should not look up this patient's protected health information for personal reasons. The healthcare industry, including hospice organizations, in general have seen an increased level of scrutiny and oversight by regulatory bodies regarding implementation of HIPAA laws. There's also been an increased level of scrutiny when violations of the HIPAA laws occur. This increased scrutiny is expected to continue, and the numbers of audits by regulatory bodies is also expected to increase. Here are some examples of what are considered Level 1 violations of HIPAA laws per community hospice policies and procedures. These are some examples of Level 2 violations per community hospice policies and procedures. Here are some examples of Level 3, the most serious level of violations per community hospice policy and procedures. Level 3 HIPAA violations under community hospice policy and procedure most always results in termination of employment. Everyone should keep in mind that fines and penalties can be assessed under both the federal and state laws. Both the individual and the organization can be subject to fines and penalties. Employees, volunteers, and students of community hospice should develop an acute awareness of their surroundings and their work habits related to protecting protected health information. Developing good habits about where, when, and how you discuss protected health information is the best way to decrease this most common of HIPAA violations. A community hospice employee once was accused of violating HIPAA by someone who overheard a conversation in a hospital cafeteria. During the investigation, it was revealed that the employee was discussing her sick dog, Molly, with a coworker, but the person who overheard the conversation was convinced that the community hospice nurses were discussing a current patient. Remember, perception of wrongdoing is powerful and can bring on an investigation by regulatory bodies and or damage the reputation of community hospice in the community. We can only share protected health information with individuals who can provide us with the patient's security code. The security code is the same as their patient number.
I am a hospice aide. When I visited Mrs. Stroh to help with her personal care, she tells me that her neighbor, Mrs. Clott, had been admitted to hospice. She states she's very concerned about her friend and asks how she's doing. I told her that her friend was admitted after having a stroke and is doing well. Did I do the right thing? I did not want Mrs. Stroh to worry about her friend.
Ask yourself these questions. Did the hospice aide have the permission of Mrs. Clott to share her personal information? Would you want other healthcare workers to share your personal and protected health information with your friends or family without your permission? So the answer is no. The hospice aide should never share one patient's information with another. Remember, leaving a patient's protected health information out in plain view in a vehicle is a HIPAA violation. Also, taking the protected health information of one patient into the home or room of another can easily lead to a HIPAA violation. These types of violations are punishable under community hospice policy and procedure. A social worker, Bob, is visiting Miss Stroh and Miss Clott this morning. Before leaving patient Miss Stroh's home, he leaves a message for the chaplain to call him regarding her request for chaplain services. When Bob arrives at Mrs. Clott's home, he takes Mrs. Stroh's travel chart in with him in hopes that chaplain will give him a call back. Was Bob diligent in protecting Miss Stroh's protected health information? Does the social worker need Ms. Stroh's protected health information to provide care to Mrs. Clott? The answer is no. Bob was not diligent in protecting Ms. Clott's information. We should never take the protected health information of one patient into the home or room of another. It's important to establish positive habits like retrieving protected health information from fax machines quickly, using the lock print feature on printers, securing protected health information on your desk before walking away, and ensuring that all protected health information that's no longer needed is placed in the appropriate shred bin. Fax cover sheets are located on the public drive or can be obtained from your supervisor. Password protection and security is crucial for electronic devices, and this is an area of great scrutiny by regulatory agencies. Red is the on-call durable medical equipment driver this weekend. Red sends a text message to the triage nurse requesting the equipment needs for Mrs. Klott. Instead of using Mrs. Klott's patient medical number in the text message, Red uses Mrs. Klott's name because it's faster than looking up the patient number. Did Red do the right thing? After all, he's the only driver working this weekend. No. Red should have used the patient's medical record number and initials. We should never use the patient's name when sending text messages or email transmissions, as this could result in a HIPAA violation. Eddie, an inpatient unit nurse, is charting outside a patient's room using the computer on wheels when he's called to a patient's room. Expecting that he will be right back, he leaves his computer unlocked and goes to the patient's room. Did Eddie do the right thing? After all, the floor really doesn't have any visitors at night. These are the questions to ask yourself. Do unauthorized persons have access to a patient's PHI if a computer is unlocked and unattended? And am I responsible for any protected health information that is inappropriately assessed under my user ID and password? So the answer to this scenario is no. Eddie should never leave a computer unlocked and unattended.
Reporting reasonably suspected HIPAA violations. You can report reasonably suspected HIPAA violations to your supervisor, manager, or volunteer engagement specialist. You can also report directly to the Chief Compliance Officer, Kenny Stevenson. His extension and email address are listed here. The risk manager and the compliance department may also be contacted to report suspected violations. Any lost or stolen electronic devices should be reported to the IT department as soon as possible so that they can be disabled. It is also possible to report suspected HIPAA violations anonymously through the Community Hospice Alert Line or NavX Global, our third-party vendor.
If you follow these 3 basic rules about protected health information, privacy and security can be easily maintained.